Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
The fact that melanoma, which is a skin cancer, which is not very common, but it's very deadly in Black men, and it's also deadly in women, Black women as well. It's not as common in Blacks, but I think I'm going to try and get a dermatologist to come on and talk to us about getting the skin evaluated for cancers, because skin cancer is still a common cancer, more common in whites than Blacks, but I've seen a number of Blacks who died from malignant melanoma, so that's something that we don't see very much that we need. How many of you actually have been to dermatologists?
Mm-hmm.
A lot of you. Oh, okay, that's good.
Yeah, I'm seeing a doctor Callender right now.
Yeah. My cousin, yeah, she's one of the most prominent dermatologists in the DMV area. Yeah,
I'm seeing one once a year. He checks a particular mole.
good.
And he's done good. Yeah.
Good. That's good to see that all of you are very sensitive to it.
I love her office. It's so swank.
Oh yeah, it's pretty.
Chandeliers and everything is pretty. She has two offices.
Yeah.
Yeah.
Mhm.
One profession I have not visited. I guess I need to add that to my list.
Yeah. Well, it's interesting that because most of the cancers affect people who are lighter complexion, white really, but it's interesting that the melanomas that I've seen in Black patients have been in darker complexion patients. And places that has occurred, for example, have been in the scalp and in the feet. So that's sometimes it's, for example, the lady who had it, her beautician noticed that there was something in her scalp, and it turned out to be malignant melanoma that actually killed her.
Wow.
So.
A lot of Black people don't think they can get sunburned. Well, I got sunburned.
All of them can be sunburned. It's just a matter of if they don't have the sun protection, all of us can be burned. So no matter, even if we're darker skinned, still, the lighter you are, the easier it is to burn, but we all can burn.
And you think that you get sunburn from the sun, the hottest time of the year, July, August. I was at the beach in May, did not put on sunscreen, and I sat on the boardwalk for a long while just talking. And later that night, when I still have the burn on my arm where my sleeve was and my pants, where the pants ended, and it looks like on my pants, I have a tattoo. And it's slowly, very, very slowly going away. It looks like it happened yesterday. And this was in May. So put your suntan lotion or whatever on, preventive on.
Yeah.
Needed. Yeah.
There's only one thing I want to add to that is look at your container of your sunscreen or sunblock, because there are some very potent chemicals in most of the sunblock that happened, before the last few years, that kills the coral. So as a diver, we have started to promote the Reef Safe sunscreen, which doesn't have those oxybenzene chemicals in it that actually kills the coral. And you kill the coral, you kill the fish, then we don't have fish to eat.
Okay. You got a number of articles to discuss. Some more exciting than others. One of the articles that we didn't discuss 2 weeks ago, but we probably should have, but somehow we couldn't do all of them, was an article that said for the first time in history, they've been able to freeze an organ, and after they unfroze it using a special technique, they were able to use the organ for transplantation. This happened in animals, but this is the first time it's ever happened in any species, and so is it possible that down the road we may be actually able to freeze organs and keep them for indefinite periods of time, and then unfreeze them and transplant them. So that's the first time it's happened in history. So anyway, that's one of the more amazing things that has happened recently in science. This is an interesting article from the longest study on happiness. It's interesting to follow up our meeting of last week when we talked about the psychological aspects of life. And remember, we had a presentation a couple of years ago, Are Blacks Happy? And the study revealed that Blacks were happy. And that was astonishing in many ways, because there's every good reason for them not to be happy because of the racism and so forth. And so it's, and of course, one of the biggest reasons was, surprise, surprise, their religion and their spirituality that allowed them to be happy, even though circumstances were not ideal. Because you see, the factors that alone do not guarantee happiness. Professional success is not, social skills, loneliness, of course, and of course, happiness is not necessarily constant. But I think that one of the most important factors that determines whether you're going to be happy or not is what you in your early years decide is important to you. And you know, integrity in many ways is part of it, because being true to yourself and being true to your own expectations is probably one of the most important aspects of happiness. If you have a vision for yourself and you accomplish that vision, then you're likely to be happy. If you have a vision for yourself and you don't accomplish it, that of course is likely to result in you not being happy. Anyway, they talk, as you scroll down, you see other aspects of what they attribute to happiness. And I think we talked about that, I guess, in the meeting last week, in terms of what are the factors that really help you remain optimistic in spite of all the reasons for not being optimistic. And no life is free of difficulties, and we attribute often resilience to be an important part of happiness. But that's resilience is based upon what your beliefs are and what your background is. And And I think that's why so many people in this group seem to be happy, because they have a spiritual background, and they have a trust in the higher being that makes a difference. Any comments about this article on happiness? And this study is, I think it's over 85 years that they followed individuals, and so it's the longest lasting study of its kind, and it highlights the importance of what we have in this group here, which is social interactions, as well as spiritual faith and spirituality. Talk about the social skills, and when they talk about social skills, one of the most important social groups is often for people is the church. And of course, this group is an example of social interactions. Any other comments about happiness?
Dr. Callender, I like the part it says it's essential to have someone with whom we can vent. I need that a lot. You know.
We all need it a lot.
Mhm.
And one of the things that meditation and prayer does is that it allows you to have that venting and letting it out, whether it's to your God or to your friend. And of course, some people have many friends, some people have few friends. So does it matter? And what is a friend? You know, one of the things that people talk about is venting and telling people about themselves. And confidence is something that is rarely kept. And so most people therefore keep their friends to a minimum. How many friends do you have?
A few that I consider, a lot of people consider me their friends, but I'm not. So I'll say a few, you know, close, what I call close friends, someone that I don't, you know, expect any negativity or anything like that. You know, they'll let me just talk. But I got a lot of friends who'll just talk to me. I listen.
Yeah, I do too. I have a lot of people who I listen to, but I have very few friends who I really tell all. As a matter of fact, the only person I probably tell all to is my wife and my God. That's it, probably. The rest of the people I usually listen, because people need you to listen to them, because they want to vent. And most positive relationships are based upon somebody being willing to listen. And the next part of it is that to keep the confidentiality of the relationship. And that is another reason why most people have few friends, because a lot of people are not confidential. They want to tell your business everywhere. And that rules people out for being good friends. And some people, because of that, they are afraid to vent, and so they'll go to a psychologist and vent, but they won't vent with anybody else. And anybody else have anybody has many friends?
Dr. Callender, one thing about our friends who want to vent, you got to be careful not to give them advice, because I don't think, in most cases, They don't want advice. They just want to vent and let you listen. They don't want solutions. You know, they don't want problem solvers. They just want you to listen.
That's an important observation.
Yeah,
And if they want advice, they'll ask you for it.
Right.
If they don't ask you for it, then you probably ought not to give it to them.
I agree with that part about advice. You know, I've learned to share my experience rather than give advice. If somebody shares something that I can relate to, I can say, well, this is what I did, and this worked or this didn't work for me. I'm not going to say, well, you should do this because I did this and it worked, because it's not the same for everybody.
Well, like
Any
a
other-
psychologist, you let them find their own solution and tell them, yeah, try that. But most, those psychologists, they let you work out your own problems, your own way, because usually you're not gonna take their advice anyway. I don't take their advice. So you let people work it out, let them vent, let them work and say, what did you try? Or, let them work it out. But the human nature part is to tell them what to do and tell them that they're not stupid or anything, but just tell them what they should do. But it's not gonna work. So you just quiet. You just let them vent.
I keep my friend list short, and I have just a very few that I can talk to about anything. I'm like you, Dr. Callender. My best friend, you said yours was your wife or is your wife. Mine was my husband. And now I have two girlfriends in particular. And those two, I can say anything. And I am one that holds a lot in. And sometimes you need to just put it out there. And a true friend is someone who listens. You're not always waiting for their advice or their opinion. Just listen to what you have to say. Every now and then they'll come back with a comment that makes you feel like, okay, that's right. I'm doing something right. Okay, I needed to hear that. And I have one every day. It starts with the scripture. The cell phone will go off. And you need that from time to time. So yeah, I keep a short friend list, and you have others that you can talk to, but you wouldn't confide in. So a true friend to me is someone that you can confide in.
Thank you. Any other comments?
I agree with what everyone has said. One of the things that I base my friendship on are my friends and how they relate to my core values, things that interest me, things that I like, my spiritual background, and that really helps me to decide on who my true friends are.
And one other thing, I stay away from sad sacks or someone is always negative and gonna bring you down and talking about everybody else. Those
Right.
type of people, I'll just say, see you later, or I got a phone call or something. And I dismiss them real quick, because those negative people, they just bring you down. And if you thought you were happy, you won't be by the time you leave them.
Right.
So true.
Well, that's an interesting perspective, because one of the things that I have taught to some of my students is that it all depends upon your perspective. Because, for example, is there such a thing as destructive criticism? In many ways, most people would say yes. But to me, I don't believe there is. Why? Because if you have something destructive to say about me, I'm going to take it and use it in a constructive fashion to try to make myself be the best that I can be. So I think it's really up to you if you allow the destructive nature of people to destroy you, or if you can turn around and use it to be constructive, especially if they're going to be critical of you. But when people are not just critical of you, but critical of everybody, and that's what Carol is talking about, then there's no positive take on that aspect of it, because they're just negative. And that, of course, is one of the most, love is the greatest force in the world, and negativity is probably one of the most destructive forces. So, Carol, you're wise. Any other comment? Okay.
Callender, what about when someone is venting and you don't have time for it? In other words, somebody wants to vent and you just don't have time to listen to them vent.
Well, you're human. You have needs as well, and so you can't help everybody. So you try to help as many as you can. But you're right. Sometimes you don't have the time, and what do you do then? I guess you have to be honest and tell them you don't have the time. And that is unfortunate, but that's the reality of life, that you personally can't help everybody.
Yeah, it is unfortunate, because I know of an incident where, the wife came home to tell her husband about her day and how frustrating her day was. And his answer was, listen, I've had a long day too, so I don't want to.
Well, if that's your wife, that's unfortunate. And and of course, as husbands, we tend to be guilty of that more than any other group of people. But that's something that we have to try to do better about. I know that I fail in that regard myself. But there's room for improvement for all of us. So for those who are very close to us, we have to try to find time to listen to them.
I have a daughter-in-law who can listen to my grandchildren and act like she's all into it. They're telling them about what they did at school and what boy saw this and girl and all this. And she said, yeah, and just egg them on. And they're so excited about that they're actually talking to somebody. And I told her that is good for her, because they'll talk to me and I pretend like I'm zoning out the whole time they're talking, because they're so frivolous. But she really puts herself, she said, I'm not really, but they think she is. And I said, that is a technique that can be desired. They'll talk, but if you're talking to, they say you need to talk to the younger generation and let them talk. And I sometimes just finding myself zoning out.
Well, we're human. Yeah, we're not perfect. So we all have room for improvement. Does it work the opposite way, that wives don't have time for their husbands, or is it only the husbands that don't have time for their wives?
I ain't
Any,
touching.
any comment on that?
It goes both ways. I mean, for the wife that's working and the husband that's retired, the wife is a lot busier and preoccupied than maybe the house husband might be. So I think it goes both ways.
I find out you both got to be sorted. When someone is venting, you got to know the circumstances and what they're talking about. And they're venting about something that you don't know what's all going on, or even the terminology. You do tend to zone out. So if a husband and wife are in the same field, or they are in the same organizations and they know what the other one is venting about, other than that, you're just a silent listener. And a wife who's not really involved in her husband's career or activities, and they're talking about something and you don't have a clue what they're talking about, it can't happen that way.
That's interesting, because when I got married, I wanted a wife who wasn't in transplantation because I wanted not to have to come home and bring all my transplant business to my wife. But that was my advantage, but that was to her disadvantage. And so I've spent a lot of time recently trying to overcome that hazard, which is comfortable for her because she's a nurse, but she has a lot of questions, and I have to try to give answers. And I get better at it as time goes on. But then I've only been married for 55 years, so.
But you two are in medicine, and that's an equal thread. Like John and I are both in music, even though he has another way of music, and then he's into a lot of other things. But there are some couples that are in the same field, and that helps, I think, tremendously. I don't know how musicians would be with a non-musician as a mate, but it helps if you're at least in the same field or in, like, even going to the same church or something that you have in common thread as you go through this life.
Yeah. Well put.
Joyce was saying something.
I'm trying. Here is with Reggie and I, we are in the same profession, different skills within the same profession, but we share a lot of knowledge within the same profession. But he is more politically inclined than I am. Sometimes we can bump heads with that, but then we will be able to talk about them and come to a common ground. So it does help with us when we come down to things that we both share knowledge in, and things that we kind of have to work a little harder together to come to a common goal.
Okay, let's go to the next article. Thank you very much for sharing. I don't know if you've encountered people with narcolepsy, but one of my wife's best friends has narcolepsy. And actually there was virtually little effective treatment for it until recently. And now they have approved this drug that is supposed to treat. Have you met anyone with narcolepsy? Have you met anyone with narcolepsy?
What is
happens
narcolepsy, Doc?
they fall asleep in the middle of the conversation, and then when they wake up, they continue the conversation. And it may be a minute or two. They start a conversation, then they go to sleep, then they wake up again. So now some people think that they're on drugs.
Yeah.
They're not on drugs. This is a disease that affects people, and they're not high now. There are people who are high who do this. Nod, they call it nod. But I'm talking about those people who are not on drugs, who actually fall asleep in the middle of their conversation, and they wake up and continue it. So anyway, this is a medication that is now effective and is available. Take at night.
I had a cousin who had this condition, and he would be talking, and all of a sudden he would become quiet. But the scary part about it with him with the condition is he was a metro bus driver.
Oh, no.
Sometimes he would nod on the job. Eventually he had to retire because of that.
Oh.
And towards the end of his life, he came down to with dementia.
Mm-hmm.
And no one really understand if that was an onset reality for dementia or not. But he finally passed with dementia.
Wow. Yeah. Okay, let's go to the next one. This is an article I put in because people talk about REM sleep, which means eye motion, that while you sleep, your eyes are roaming around. And this is thought to be the kind of coma that is most helpful to the brain, although there are many takes on this. But at one point, they thought that REM sleep was the most effective sleep that allowed you to remove the toxins in the brain. And we now know that that isn't exactly true, but still, people talk about REM sleep, and then they talk about the other kind of sleep, and they think that the most effective sleep is when your eye movements, whenever your eyes are blinking, and that this then is the best sleep. School's not out on it, although they've been talking about this for the last 50, almost 80 years. And that people who, the longer you have REM sleep, the better off you are. And that's when you're having active dreaming and your eyes are blinking. And so that, and many people just say that they divide sleep into categories, whether you have REM sleep or you have other types of sleep. And if your eyes are moving around, they think that that's your brain is being cleansed. That's an exaggeration on it, but of course the need for sleep is ever emphasized, but the categorizing of sleep into different phases based upon EEG analysis is something that people talk about. And one of the things that you heard the Dr. Evans talk about last week is that people who have insomnia or inability to sleep need to see sleep specialists, because they are so-called sleep specialists. And they believe that all of it is treatable by psychoanalysis or medications. So, and it was interesting to hear Dr. Evans talk about the different mental illnesses that occur. This association of REM behaviorals with Parkinsonism it does not seem to be that close, but it's something that remains to be seen. When you sleep or you're in coma, it makes you wonder, because when you go to sleep and you wake up, you've been unconscious. So, or are you? And that's what REM is about. That you're having dreaming, and your eyes are moving around because you're really doing something.
Yeah, Dr. Callender, they don't talk about nightmares as opposed to pleasant dreams.
Yeah, right. You're right. They don't distinguish, because we have both. We've got the nightmares as well as the wonderful dreams. So now this is an article that talks about something we've noticed for quite a while, that optimal sleep, meaning sleep about 6 to 8 hours, is tied to lower mortality risk. This has been something that we've talked about for quite a while, and that when you don't sleep 6 to 8 hours, it has a negative effect upon your thinking so used to doing things that you can do them in your sleep, we say. It appears that even that is associated with a higher mortality if you don't get enough sleep. Any comments on this sleep issue? Because I know people who never get 7 hours of sleep. And I know people who believe 4 to 5 hours is all that they need. And some people function well on that, but most of the data suggests that that is not healthy. And you don't have enough time for your brain to eliminate the toxins. But there are exceptions to every rule. So
Now, Dr. Callender, is this 7 hours of peaceful sleeping? Or, you know, we talked about the rapid eye movement. Is it peaceful sleeping or is it all sleeping, total sleeping?
all sleeping, because REM, looking at the way they characterize REM, the so-called peaceful sleeping, most people only have about two hours of REM, whereas they have large hours of the other type. So they're talking about the overall sleeping.
Okay. Thank you.
Are they also talking about, when they say 7 to 9 hours, they're talking about straight through, aren't they? That discounts waking up in the middle of the night, you know, like after 4 hours, going to the bathroom and going back and getting your other 4 hours.
Well, I think they're talking about total sleep.
Total, okay.
Yeah, total sleep. It's interesting how they saw this association between esophageal cancer and sleep habits, although whether the two are related, I wonder. Because things happen together that don't always mean that they're related, but anyway, they made this observation anyway. And it's interesting here again, they talk about, you see some artists that say daytime naps are great, and you have this one that says that it's not so great. So, which is right, who knows? It seemed to me there are more studies that show that daytime napping is good, but they also say that it shouldn't exceed an hour. But
Daytime napping seems to be good if you didn't sleep well during the night. You only got 3 or 4 hours of sleep, then it seems like daytime naps are good.
okay, but anyway, it's interesting that they made this observation. So let's go to the next one, please. And this, so it looks like there are a lot of articles on sleep this week. So those of you who sleep 6 to 8 hours a night, and those who sleep less, take a note. It's interesting that children sleep so long and adults relatively sleep so short. One of the things that I've also noted is that many of these studies have been in non-minority patients, and they don't really characterize who they're talking about. The presumption is that all comers, but I don't know. This also talks about the fact that the benefit of exercise is negated by not having proper rest. What about sleeping pills? That's interesting. It's interesting the kind of medication we've used for patients to get them sleep and the side effects that some of these medications have. Some of the behaviors after they take these medicines is what, and also the addictive nature of some of those sleep medications is what forces most to give a limited amount of sleep medications. I've had some people have to take the sleep medications and then they wind up doing things they wouldn't ordinarily do when they're awake. Driving, doing things that they wouldn't ordinarily do. So this is an interesting golden rule of sleeping. I never heard that before. Counting your blessings. Maybe that's one way to go to sleep. You have so many blessings. We have so many blessings that may be enough to put you to sleep. What is it? Count your blessings, name them one by one, and it will surprise you what the Lord has done. I know you all know that one. This is another article that is distressing, especially for us in the United States, that maternal mortality risk remains so high in one of the richest countries in the world. And we talk about it, but it doesn't get any better. And it affects the American Indians, Alaska Natives, and Black women. My mother died when we were born, so I have a particular respect for maternal mortality.
Dr. Callender, it seemed like that group of Black women are also the group that gets the worst amount of health care too.
Well, I would argue with that because Black men seem to have the worst medical care than Black women. I mean, but who wants to win the battle for worseness? Anyway, but Black men seem to, as we all know, live shorter lives than Black women. So they do outlive us, and but this maternal mortality is particularly troublesome. That we've been talking about it for at least 50 years, but it seems to be getting worse.
So, Dr. Callender, does maternal mortality mean death giving birth, or just other complications after giving birth?
It applies to death within 48 hours of giving birth.
Well, then men aren't in this study. That's it.
No. This is the only women, only women can give birth. So, yeah.
So far.
I
Yes.
hope not, John.
No, well, they
So
had
far.
an experiment. Yeah, they had an experiment where they put a fetus inside of a man, but it didn't live. I don't think.
Why would anybody want to do that? So it's problematic that people of color have this issue, and it probably is related to the social determinants of health again. So one of the things you have to try to have access to care for all Americans.
Dr. Khan, that's also the group that doctors feel can stand the most pain too. Withstand the most pain.
Yeah, well, that's, it's interesting that the Bible talks about the fact that women give birth, and after they give birth, they forget about all the pain because of the joy of dealing with the children that they give birth to. But yeah, it's true that they experience pain, that pain, delivery, and yet they don't complain about it that much. That doesn't mean that it didn't hurt that much. It just means that the joy of the delivery of the child compensated for it. And the belief that blacks felt less pain is untrue.
It's
But
racist.
that's what yes, but that's what they like to believe for some reason.
Racist.
Yeah, they treated us horribly, believing that we didn't have pain for some reason. I don't know why. Now this is something that was kind of new to me, that pulmonary function test, because of the race-specific equations they use, pulmonary function test. There's bias in that also. And that's alarming to me. It's bad enough that the blood gas, the respiratory, the pulse oximeters, because of the complexion, gave erroneous readings, but to have the pulmonary function test to also be racially biased is shocking. And it's something that they're talking about working on. Just like the GFR, the glomerular filtration rate, they had a black determination of it as well as a white, and that has been changed recently. It's interesting that race, although a social construct, has infiltrated every aspect of life. And this is not good. And it's something that's difficult to eradicate. Everything you read, they talk about race when they really mean ethnicity. But be that as it may, this is what we have to face. And of course, the group that is affected more than the black group, or as much as the black group, is the Asians. Because the group we call Asians are so dissimilar from one Asian group to the next that it defies the imagination that we should try to think that they are a different race when they're just different ethnicities. But anyway.
I had a question, Doc, about pulmonary. Is that heart or lungs or both?
Lung.
Lungs.
Only lung. Because the cardiac function tests are completely different. And they have there's no racial aspect that you either have ejection fraction that's 100% or whatever fraction of 100%, regardless of your ethnicity. Whereas with the pulmonary function test, they have all these equations that they use to determine what your pulmonary function is. So this is just the lung, pulmonary lung. And we have sarcoidosis and other conditions that particularly involve Black people and Black women. And so this racist aspect of it needs to be done away with.
It's called playing the race card.
every day. Now, this is a important article in the sense that you want to really know what your blood pressure is. And this talks about what does blood pressure mean. The top part, the systolic, the bottom part, the diastolic, and what is the normal? It's a number of, and what is a healthy blood pressure, and you know, we've had so many changes in what is the normal blood pressure. Is it 120? Is it 130? Is it 140? And so right now we use 120 over 80, but there are data that suggest that 140 over 90 may be normal for some people as well. But the bottom number is supposed to be 80, lower than 80, and the top number is supposed to be less than 120 or less. And so some people feel that when you're older, your blood pressure can be normal, even though it's a little higher, maybe as high as 130 over 80. But the data is conflicting in the sense that some studies say that when you try to keep people at 120 over 80, sometimes you get too low and they have complications. And so as you age, they think that you're more likely to have trouble trying to get to 120 over 80. And therefore, they think that the number should be a little higher. But I think for all of our screenings, we use the number 120 over 80 as normal.
Dr. Callender, question. As you age, do your blood vessels, your blood vessels, don't they narrow when you get older?
Because you have arteriosclerosis.
Yes.
And that's not, in other words, that's not, that's a disease.
Right. So then that means that that's going to change your blood pressure readings.
Well, but that's still not normal. Yeah, you're right, but it's not normal. And one of the things that we have to do is to be sure that the blood pressure is accurate, that you have the patients who sit down for 10 or 15 minutes and then you take the blood pressure. Often in the doctor's office, they may not wait for you to sit down for 10 or 15 minutes. And so the blood pressure may not be accurate, which is why the most accurate blood pressure probably is the blood pressure you take at home under ideal circumstances. And
so what you're saying is the stress of being in the doctor's office can affect your blood pressure.
Called white coat hypertension.
Yeah, right, yeah, exactly.
Yeah.
Mm.
This is interesting. I thought of Tatum and others who like puzzles. And mental gymnastics is what I call it. But they suggest that these mental gymnastics can decrease the likelihood of Alzheimer's. You see here, they say they reduced dementia risk by 11%. Interesting. I'm not sure I understand who they tested and whether they tested all ethnic groups or not, and the number that they have, do they include the different ethnic groups. For example, this study here is from Australia. But anyway, it's an interesting idea that mental gymnastics is helpful. And look, they talk about 10,000 over 70 in Australia, tracked for 10 years. So it's a large number, even though it is Australians. And they have ethnic characterizations that are less like ours. The native Australians they treat differently, and they may not, probably not even in the study. What are your thoughts, John?
That's my plan, is
Yeah.
to play chess to fight off, dementia and Alzheimer's. That's my plan.
Okay. You believe it, huh?
It's helping so far.
John, and look what you wrote on the screen there. Can you erase that mark?
Yeah, I have to get the eraser.
Okay. Dr. Callender, I do Sudoku. It's a numbers game. I play that a lot. I used to play solitaire a lot. That got kind of boring. But Sudoku is pretty tricky, especially when you get to the harder levels. I recommend it.
Well, as they say, with the fact that we don't have a treatment for it, effective treatment for it, makes it important to take the advice that you've given us. Exercise and mental exercise. Now, this is an article that's kind of frightening. That patient aggression against receptionists and others in the doctor's office is increasing. And what do you do about it? Should you have protocols that allow patients to express themselves without throwing syringes and screaming at the receptionist?
Well, we talked about that earlier. That's called venting.
Yeah, venting on the receptionist. Yeah, so
Nurses throwing pillows at the nurses.
well, actually, this is primarily talking about the receptionist, who may be a nurse or may not be a nurse. And since it seems as though it's so common, the question is, what kind of protocols should we put in place to protect the receptionist? As we become more violent, it becomes more important to have the receptionist aware of the patient aggression that occurs. And as you know, this has been experienced by nurses and doctors, as well as receptionists. But this particular article is particularly addressing the receptionists, because by the time you get to the doctor, you've had some time, but there's no cooling down for the receptionist. So they talk about designing rooms so that you have a safe room and a cool down room, and having shields between patients and the receptionist, which is an easy way to deal with it, so that they can't reach the receptionist. They can just communicate. Have you seen, when you're going to see your doctor, have you noticed any of these protective mechanisms?
Dr. Callender, I think this is in all realms of our lives. There was an article about airline stewardess, and they were talking about the way you dress, maybe that'll calm you down. But I seem to think it stems from our children, of how we're raising them. There was a time that children were taught respect of how to talk to older people, and there were certain things that you just would not say, but now it's allowed. There was a time when you could not curse in school or out of school, or show people what you really feel. When we have a president of the United States that can call people names and not receive any repercussion from it whatsoever, I am thinking about our whole society is doing that, not only receptionists. There's this way of being respectful. You couldn't tell anybody off. Children can tell adults off, and parents allow it. And there's some kids, they'll tell their parents off. And because they say you cannot chastise them the way you want to. So I'm thinking, this is just not a problem of receptionists. It's becoming a problem of our whole society, of how we talk to each other and are respectful. And it started, Trump had to learn that this was an okay signal to say things that he can say, and nobody sues him for slander or tell him that he cannot say this to someone else. In fact, we all laugh and make fun of it. Then when we have somebody, parent that's upset, goes into a receptionist's office and starts slinging things and hitting things, and no repercussion. Nothing is in our law book that said that you cannot treat other human beings in this fashion. Then this will continue on. You can put yourself into a cage from now on, whenever you're dealing with the public, because this is going to progressively get worse.
And then, of course, a guy was killed in his own clinic in the dressing room. So the physicians and as you remember, black orthopedic surgeon was killed in his office as well. So and your point is so well taken. That this is wide reaching, and it begins, as you say, at home.
To Carol's point, though, I'm attending a lot of board meetings, and there are whole lots of fights and arguments and disparaging remarks at board meetings that I have been attending.
When you say, you just mean verbal attacks, right?
Yeah, verbal attacks, yeah, but
Okay.
no, it's not as bad as bringing guns to the meeting or anything like that. But I'm just talking about it's just so much aggression toward each other at these meetings, arguing back and forth, cutting off each other's conversation, yelling, screaming,
Yeah. Yep, we see it every day.
Of course, MOTEP board, they don't argue.
Well, I think, dialogue is important. Hearing both sides of the story is important. So to me, it goes with the turf. But I think it's important to hear both sides of the story. And I think unless you hear both sides of the story, you haven't heard the story. What do they say? The three sides, my side, your side, and the truth. But I think it's important that both sides be heard. So dialogue is virtuous as far as I'm concerned.
I remember my days with the underwater adventure seekers. Some of those meetings. Oh my goodness.
Underwater?
Yeah, underwater adventure seekers. Yeah, that was John Buchanan's group that he was in.
Oh.
Lots of fighting and arguing. But it was
Really?
just mainly one person, though. One person just tore the whole thing up.
Wow. This is infection-related deaths from dialysis have declined, but still remain high. And the thing about why this is the case is that you're always invading the body with dialysis, whether it's the peritoneal or the vascular access. And so as long as you're putting things inside the bloodstream in the body, the opportunity for infection becomes possible. And yes, it's decreased, but as long as you're going to have that entry point, you have to be absolutely sterile, and any break in technique results in infection. And there's no escaping the fact that dialysis saves people's lives. It's just that in the effort to save people's lives, we increase the likelihood of infection. And also because with renal disease, you weaken the immune system. So the renal patients have a weakened immune system, and they're more likely to have an infection. So it's the disease itself, and then it's the fact that the treatment is invasive. But we are getting better, so that's a good sign.
Dr. Callender, as far as getting better at that, since you know that, whenever you go into the hospital, they get you to sign a waiver, saying that you understand the risk of infection, et cetera, et cetera. So what you're saying is that they're working on preventive measures to infections now when they're doing surgeries, et cetera.
Well,
Antibiotics.
well, this is particularly talking about antibiotics, because the prevention is to keep the area clean,
Right.
free from bacteria. So the preventive aspect of course, is paramount. And so we have to work on both ends, preventive aspect as well as having antibiotics. But the best treatment, of course, is prevention. And being aseptic becomes critical. It just seems more critical in peritoneal dialysis because if you get peritonitis, that's a big problem. Whereas if you get an infection, a local infection for the vascular access, it's not as lethal as peritonitis. And if you get peritonitis, then they have to stop peritoneal dialysis and switch you to hemodialysis, which is, if you get an infection there, it's probably easier to treat. And the number of types of vascular access, including putting a catheter in place, which is the one that is more associated with infection than anything else. The fistula and the graft are actually placed internally. And so the fistula is thought to be the one that is associated with the least infections because it's your own blood vessels, whereas the graft is artificial blood vessel, and therefore it's more subject to infection than the fistula. So, but the bottom line, as you pointed out, is an ounce of prevention is worth a pound of cure. And so most of it is to maintain sterility and keep the bacteria out from the get-go.
Dr. Callender, so I have a question about the difference between hemodialysis and peritoneal dialysis, and are there other types of dialysis?
Well, there's the two are the hemodialysis and peritoneal dialysis. Hemodialysis, they use the blood vessels as the route to clean the blood And the peritoneal dialysis, they use the peritoneum, the abdominal cavity, to clean the blood, clean the fluid out, actually. Peritoneal dialysis is done with fluid. Peritoneal dialysis is done with blood cleansing, so to speak. And so they put a catheter into the peritoneal cavity, and then they flush the fluid in and out. With vascular access, they actually go directly to the bloodstream and take your blood out, purify it, and then put it back in. So that's the difference between the two. One uses the blood vessel itself, or either they create a blood vessel they put in, which is called a shunt, or a fistula, where they actually connect the blood vessels, the artery and the vein, and they dilate each other. So
What are they removing in the hemodialysis? What are they taking out?
your blood, and they send it through a machine, and the machine takes out the toxins.
Okay.
As a machine that does it. It's a machine in both cases. It's just that in the vascular and the hemodialysis, blood is the fluid. In peritoneal dialysis, it's a special solution that they use, but it's not blood. And that's why it's hemodialysis. And then peritoneal dialysis, they have a peritoneal dialysis catheter they put in the abdominal cavity, and then they wash it out. And by washing it out, and that's why it takes so long. It takes about 8 hours because they're using the peritoneal cavity. Because of the fact that they taking the blood in and out, that's why the period is shorter, because it's exchanging the blood is a process that sometimes results in patient feeling very weak and tired.
Dr. Callender, I just read that the dialysis was invented in around 1993. And
No, it's not true.
when was it invented?
1960.
Okay, they said that it hit the population in 1960 in Washington. When did you remember that it was first used among various hospitals?
1960. In
1960?
1960, yeah.
Oh,
I
okay.
know, because I was there. I was doing it in the 70s.
Oh, okay.
And the first thing that was developed was actually peritoneal dialysis. And then late in the 60s, they started doing more vascular access and shunts and fistulas and grafts. Yeah, but it started in the 60s.
Okay, I guess they said it came to the United States and was in the United States by the 60s. I'll look that back up again, because it said before it actually hit, because I was just thinking about my maternal grandmother had kidney disease, and she died in the 60s, early 60s. And I was just wondering, it probably wasn't there long enough for it to be available for her.
Well, they really just started in the 60s, and that's when they had screening processes that eliminated us early on. So if you were Black, you weren't going to get dialysis of any type. And by the 70s, then it became more available, and then you start getting the Medicare and Medicaid, and so everybody then became, so.
Dr.
So
John,
what year did the Black hospitals start getting the dialysis equipment?
No, they're not Black hospitals, all hospitals. At the beginning, they started in Seattle, Washington, actually. That's where peritoneal dialysis actually started, in Seattle, Washington. And it was just experimental. And then after, in the mid 60s, then it became available to all. Now, but what I was pointing out is they used to have a screening group. It wasn't the hospital, it was a screening group in the hospital that would identify those people who they would allow to have dialysis. If you couldn't have dialysis, you just died. Okay, and they'd allow certain people to be dialyzed, often the wealthier, and rarely the people of color. But then after it no longer became experimental because it was effective, then it became available, and then you had Medicare and Medicaid and Medicare paying for it, and then it was available to all.
Janice?
Yes, I have a question, Dr. Callender. My brother-in-law is on dialysis and he has a fistula. And recently his stomach became very swollen. He went to the doctor a couple of times before they determined that it was fluid buildup. And they removed 6 to 8 liters of fluid. What would cause the fluid buildup?
Well, there could be a number of reasons. The term is called ascites when you have fluid in the abdominal cavity. And there are a number of causes. One can be that he's effectively underdialyzed. The second could be he may have liver condition. The third could be he could have a heart failure. So that when you have fluid accumulating, it can be from the kidneys, it can be from the heart, it can be from the liver.
Okay. All of that sounds about right for him. I don't think he stays on top of his care. And he said he felt better, of course, after they drained the fluid, but
Oh, yeah.
I think something that he needs to look into. Okay, thank you.
The other
Okay.
thing, Dr. Callender, before 1960 and the dialysis, weren't they using pigs to dialyze people?
Not that I know of. I mean, experimentally they did many things, but that was not the treatment of choice. That was experiments. You're right. But Seattle, Washington, was the place where they started the peritoneal dialysis first, and then later on vascular access came into play, and then most people began to be hemodialysis, although peritoneal dialysis probably is associated with the best results if you can avoid getting peritonitis and peritoneal infection. Now, this is an interesting article that points out that if you can have home delivered meal, you're associated with reduced mortality. And it kind of points out that the social determinants of health make a big difference in everything. And I think that's what this is demonstrating. It's the same thing with the elderly. If you have home delivered foods, they also do better. But that's kind of obvious. Because if you don't have, some of them didn't have home delivery, they didn't have anything to eat at all. So. And the more we learn about these things, the more we recognize that many of the things are related to the social determinants of health and also access to healthcare. And those are really the two biggest features or factors. Something like simple like having 3 meals a day, which you may take for granted when in point of fact, some people are lucky to have 1 meal a day. Okay, let's go to the next one. This is, it's amazing that technology is such that here you have a vaccine developed in 12 months, and now You can have a detecting an air monitor that can detect the virus in 5 minutes. I tell you, with artificial intelligence, it's amazing how things change. There's no question that AI will make a difference. It will also make a difference in employment because the people who are able to use this technology are people who are educated. People who are uneducated and don't know how to use this technology are lost. And and anytime you see the consequences of artificial intelligence, you realize that while it is wonderful, it also reduces employment. But I mean, can you imagine that we're at the point where you have an air monitor that can detect the virus? It's just unthinkable 3 years ago. And now look at this. Yeah.
Dr. Callender, there's a flip side of this too, because whereas AI is, replacing people in their jobs, those people already retired, they can get a benefit from AI because they're not being put out of a job because they already retired.
Now, who says they already retired?
Well, in my
I
case,
have a number of people who have been put off jobs who are not retired; they're just unemployed.
yeah, I'm talking about people like myself. I have
Well, you're in. I mean, the older people are kind of exceptional. I'm talking about the
that's
young
what, okay, I got
who
you.
are unemployed. They would like to work, but the AI is actually eliminating their jobs.
Right. Well, AI is helping me much.
I have a question though. So what would you do if the alarm went off?
That's a good question. I think you might want to put on your mask.
But it would be too late then, right?
Not necessarily. It's a volume issue as well. I mean, it depends if they identified it early on. Hey, put on your mask. There's somebody got COVID here.
And where would they use it? I mean, you talking about in a hospital or in a school or in an airplane? What would you
Well,
do?
in the airplane, all you need is a circulation that will eliminate the virus. So, for example, an airplanes are great because they have the circulation that allows for the virus to be eliminated. So theoretically, one thing you can do, you have the air currents to take out the virus. Theoretically, if you know there's a live virus in the air, you can do that.
Dr. Callender, did I tell you that my sister got COVID over at the place where she is now?
Oh no,
Yes. She, of course, before she went to the facility, they tested her and she tested negative.
oh no,
But now she got tested again and she has COVID.
no.
Yep. She's over at the Future Care Regional Capital Region
Oh no.
Rehabilitation Center where she's getting treatment and exercise, etc. And she'll be
Wow.
there until August the 4th.
Wow, that's pretty tough. Wow.
So that's John Buchanan. That's where they might need that machine.
Well, actually, that's probably a big place and they have a lot of different rooms, right?
Yeah.
And
Yeah.
probably the circulation is suspect.
Yep.
Yeah. Wow. So she tested positive, but she doesn't have any symptoms, right?
True.
Wow.
And Carol went over there to visit her. And so, and another niece went over. The niece came back and tested herself, and she was negative. So she's not a spreader. I don't think.
Wow.
Asymptomatic, as they say.
Carol is everywhere,
Yeah.
huh? Now, this is an article about taking aspirin and the fact that those who take aspirin are more likely to have anemia, which may mean that they have internal bleeding because aspirin affects the platelets. And this is the reason why, if you don't have cardiovascular disease, aspirin is not recommended. Remember that early on, most of the cardiologists were recommending patients take 1 aspirin daily to prevent arteriosclerosis. Now, the evidence is that you're more likely to get bleeding from aspirin if you don't have cardiovascular disease. You're likely to get anemia, and also you also are likely to have bleeding from other places. So the advice to take aspirin is going by the boards, and it's not advised to take aspirin. Now, of course, baby aspirin is recommended for people who have cardiovascular disease, but not for those who don't have cardiovascular disease. Now, aspirin works on the platelets, and platelets allow you to clot and stop bleeding. And so that's why internal bleeding from in those who take aspirin is not uncommon, because the platelets no longer clot and stop you from bleeding. And so, in addition, it does also negatively affect the protective aspect of your stomach. So, is it safe to take aspirin every day? And of course, I think they generally recommend it if you have cardiovascular disease, that it's safe to do so. But bleeding is a complication that can occur. And this is the advice that they give. Yes, you have to remember that it has side effects, and bleeding is one of the side effects. You have GI bleeding and you have cerebral bleeding. So it's not without risk. The risk-benefit ratio may be better if you have cardiovascular disease, but some studies show that even in the aging, that the incidence of hemorrhagic strokes is greater in those people who take aspirin. So this is the dilemma. But it's clear, though, that if you don't have cardiovascular disease, you probably should not be taking daily aspirin. This is a new finding. Of course, many people are using non-invasive monitors on the skin and therefore finger sticks are just about defunct, because now you put a patch on and you can know whether your blood sugar is low or not. And this is kind of revolutionizing the management of diabetes. And what was equally interesting was that it was even better than finger sticks. So this is how the future is to be for diabetics, which is good news for the diabetics who had to do those finger sticks. I hated those finger sticks. So, and this shows the data that they had. You notice they didn't have a whole lot of patients in the study, but enough to indicate that it was at least comparable to, but actually it was better. So finger sticks are on the way out, thank God.
That's for type 1 and type 2.
Yeah, absolutely. And we discussed the difference between the two. Type 1 is where you have no insulin at all. And type 2 is where you have insulin, but you have antibodies to the insulin. And type 2 is treated by exercise and diet. And type 1 is treated by pancreas transplant or insulin. Type 2 is more likely associated with adults and older people, and is receptive to, and it often is treated effectively by weight reduction and exercise and dietary changes.
Dr. Callender, have you heard any talk of type 3 diabetes?
No,
I heard something somewhere about type 3 diabetes was obesity or something. I don't know.
no, I'm not familiar with it. So if you find it, share it with us,
Okay.
because type 2 is associated with obesity. And this talks about workout plans for type 2, keeping in mind that type 2 is likely to respond to the non-insulin treatment first. The issue that it brings up is people who are diabetics and no longer able to handle glucose. What do they do about sugar substitutes? And remember, we talked about that earlier this month. Any thoughts about this? I guess there may be no diabetics here, but people who have diabetes, I think this is a wonderful development. This is an article that just says that explains why everybody likes caffeine. It actually helps the brain. So, there's so many coffee addicts that they can't start the day without a cup of coffee. So this may be why, because it allows people to rest their brain to some extent and stimulate it as well. I guess most people have known that anyway. So. However, it makes the caffeine addiction more tolerable to people, I guess. Anybody not drink coffee in this group? I drink coffee only when it's cold. It's cold outside.
I don't drink coffee. The only thing I drink is water.
That's the healthiest drink of all. And the safest drink of all.
even though it does have a level of chlorine and other bacteria. Minimal amount, I admit.
It depends what kind of water you're drinking.
I only drink bottled spring water, no chlorine,
Right.
no fluoride.
Right.
And there's minerals. And so my water is not only hydration, it's also food because of the mineral content.
Speaking of drinking,
This is an article that was surprising to me. I remember that somebody talking about drinking Clorox, but I didn't know anybody actually did it. I mean, so no matter how ridiculous something you say, people are going to try it. 4% of adults drink or gargle diluted bleach solutions to protect themselves from coronavirus. That's. I mean, why? Why? I mean, just because Troop made a comment like that, 4% of Americans actually drink bleach.
a lot of people believe it.
Yeah, I tell you.
Did Trump make it popular or what?
Well, he mentioned it in one of his conversations, and you can see the outcome. What the president says apparently is very important. Wow. 10 million Americans. Woo! My goodness. Wow. No matter how ridiculous a statement you make, people will take you up on it. So that means if you're not going to say something wise, don't say something, be quiet. What does the good book say? If you keep your mouth shut, people will think that you're smart. So just keep quiet. When
If
you open your mouth,
remove all doubt.
yeah, that's right.
My mother
Yeah.
told me that the empty head makes the most noise, I think she told me. Empty barrel makes the most noise.
Yep. Now back to the artificial sweetener dilemma. Which ones are safe and which aren't? I think you're in many ways probably none of them are safe, but they might be in some instances better than a lot of glucose. And it's pretty clear that although they have not actually linked it between cancer and humans, possibly does that mean that they've proven it, but it's suspicious. And so the question is, which is safer, the sugar substitute or the sugar? And I think the sugar substitute is safer. It's been interesting. There's research on both sides. So anyway, these are good studies that make it clear that we really don't know the answer. And there's pros and cons of both sides. But most of the carcinogenic evidence is found in animals, not in humans. So is it safe? You read the data and decide. The data is equivocal as far as I'm concerned. Then this is an excellent article. The healthiest meat to eat. I can't believe it's 10:30 already. I guess this should be the last article, but this is a good article in terms of comparing lean meat to no meat or poultry. Yeah. And to recognize that you get high quality protein from soy and other things, so that you don't really need meat. So, but if you like meat and you want to eat meat, you should eat lean meat. So it's a good article, and it points out the pros and cons of both sides of the story. What is the healthiest way to eat meat? And it concludes the one thing you shouldn't do with meat, and that is fry it. They grill it, roast it, or whatever, but don't fry it. Anyway. And it gives you ideas what to cut off visible fat, small portions, use lean meat, probably a third of the plate. Use the roasted vegetables and so forth. And there's little question that red meat has been linked to cardiovascular disease. But he says that lean red meat is not as bad as the rest other red meat. And most people agree that poultry and seafood are better than red meat. Okay, so. But it says lean unprocessed. But I mean, where do you find lean unprocessed meat? So, okay, we've had a good session, a lot of articles. Any closing comments?